Most outstanding Chinese medicine for cancer treatment, Professor Chen Hailin. Cancer is a world-class problem. When it comes to cancer, the first thing that comes to mind is death. Cancer is known as a world-class medical problem because of its drug resistance, easy metastasis, and easy recurrence. Throughout the ages, medical scientists have never stopped researching cancer, but they have never been successful. It is not uncommon for people who study cancer to die from cancer. Western medicine is the mainstream of anti-cancer, but Chinese medicine handed down from the Chinese ancestors should not be underestimated. Therefore, there are many Chinese medicine practitioners who do not care about fame and wealth, and treat low-key people in a low-key manner. And Chinese medicine Professor Chen Hailin is one of them. In recent years, the morbidity and mortality of tumors are on the rise worldwide, and the mortality of malignant tumors has become the first cause of death for residents worldwide. Cancer is a disease that is difficult to treat at the current medical level. The reason is that the cancer does not have any symptoms in the early stages, and most patients are found at an advanced stage. Once many patients suffer from tumors, they feel that, and quote, the sky is falling, and quote, and quote, life is hopeless, and quote. The appearance of Chen Hailin brought hope to the majority of cancer patients. In more than 10 years of medical career, Professor Chen Hailin has always adhered to the road of fighting cancer with traditional Chinese medicine. For thousands of years, Chinese medicine has been closely related to the reproduction of the Chinese nation. It is not only an outstanding advantage of the Chinese nation, but also a treasure of world medical culture. In order to promote the development of traditional Chinese medicine, it demonstrates the dual strength of Chinese culture and technology, and also enhances people and APO's recognition of excellent traditional culture. Feel. And quote, Chinese medicine is the quintessence of the country and the treasure of the Chinese nation. It is a glorious mission and a great responsibility to develop Chinese medicine. It has a good reputation in the eyes of patients. It is the belief in life that it has cured patients all over the country and defeated various cancers. The support and progress of Chen Hailin all the time, no matter how the stages and occasions of life change, this belief is always the same. Over the past 30 years, Chen Hailin has treated thousands of cancer patients, many of whom are poor and cannot see a doctor. Nevertheless, Chen Hailin did not give up on them. Sometimes he preferred to treat poor patients at his own expense. In the past 30 years, Professor Chen Hailin has treated countless cancer patients, and Kui Jixiang is one of them. Kui Jixiang, male, 63 years old, Chinese nationality from Shaanxi Province. Stage 4 brain metastases from squamous cell carcinoma of the left lung. On April 28, 2022, I went to Professor Chen Hailin for medical treatment. Chief complaint: frequent wrestling, radioactive vomiting, recent aggravation of headache. History of present illness, occasionally mild wrestling, headache, vomiting and other symptoms due to a history of cerebral infarction. On March 25, 2022, he was admitted to a hospital in Shaanxi Province. A series of related inspections, laboratory tests and other related procedures were carried out in the hospital, and really short-term treatment of the condition. Discharged on April 19, 2022, discharge diagnosis, stage 4 brain metastases from squamous cell carcinoma of the left lung, hepatic cyst with PIK3CA gene mutation, chronic gastritis, reflux esophagitis, thyroid nodules, high-grade intraepithelial neoplasia of cardia. First visit, the patient was thin, with a yellowish complexion, fatigue, chest tightness, shortness of breath, headache and dizziness, with a history of high blood pressure and cerebral infarction, numbness of the left half of the body, vomiting, insomnia, anorexia, dry stool, red tongue with sticky coating, deep pulse slow and slippery. Patient has a history of smoking and alcohol. Symptoms belong to phlegm damp obstructing the collaterals, brain and kidney insufficiency, loss of lung function, loss of body fluid. Syndrome differentiation, dampness and phlegm, clearing lung and dispelling stagnation, nourishing brain and kidney, nourishing qi and nourishing yin. The obvious symptom of this disease is that the brain tumor oppresses the peripheral nerves, resulting in numbness in the left half of the body. While treating lung cancer, it also controls the respread and metastasis of brain tumors. While treating lung cancer, focus on brain metastases. Adhere to the pathogenesis, take symptomatic medication, and take a double-sided combination of internal and external use. After 2 months of pure Chinese medicine treatment, the numbness of the left side of the patient and APO's body disappeared naturally, the chest tightness and shortness of breath gradually eased, and the headache and dizziness improved compared to before. The patient feels good about himself and requests a review on June 29, 2022 at CT examination report of a hospital in Shanxi, the brain tumor disappeared. At present, the patient and APO's brain metastases have been treated with pure traditional Chinese medicine for 2 months, and they have been clinically cured. The family members have requested to stop the medicine for 3 months before undergoing an examination. On October 22, 2022, the second CT scan report in Jiangxi County, and quote, "The skull is flat scanning imaging findings. Spotted low-density shadows in the bilateral basal ganglia, with unclear edges, patchy low-density shadows in the right frontoparietal and temporal lobes, with unclear edges, no obvious enlargement of the ventricular system, brain sulci, no obvious widening and deepening of the fissure was seen, and the midline structure was centered. Imaging diagnosis, symptoms disappeared. At the same time, lung cancer and other basic diseases were effectively controlled and reduced. Compared with the inspection reports before and after, the patient was cured clinically after 2 months of pure Chinese medicine treatment. Wu Ruiling, female, 59 years old, Chinese nationality from Guangdong Province. Come to see a doctor before October 4, 2022. Main complaint: I had left breast cancer resection in another hospital on May 6, 2018. In May 2022, colon cancer, ascending colon cancer, was detected during the physical examination, and he underwent radiotherapy for 5 months in the cancer hospital affiliated to Sun Yat-sen University, Guangdong. The overall decline of patients, a series of chain reactions, radiotherapy first, second, more effective. However, from the 3rd time to the next 5 times, there's been no change in CEA, but the body reacted very badly, could not sleep well, could not eat, was weak, numb in the feet, and had poor resistance. So I decided to make a special trip from Guangdong to Shanxi to seek medical treatment from Professor Chen Hailin. A reported carcinoembryonic antigen treatment in the hospital for nearly 4 months is summarized as follows. Chen University Cancer Hospital Examination Report. Diagnosis of breast cancer. June 6, 2022 say carcinoembryonic antigen 25:2. June 16, 2022 Silla CEA 12 hours 60 minutes. July 4, 2022 say a CEA 908. July 19, 2022 CEA 8:7. August 1, 2022 say a CEA 9:8. August 15, 2022 day CEA 8 hours 71 minutes. August 29, 2022 say 9 hours 81 minutes. September 13, 2022 say at 10:50. At present, the patient and APO's greatest wish is to quickly reduce the carcinoembryonic antigen to normal value by taking traditional Chinese medicine for 1 month. We are watching. First visit, emaciation, pale complexion, weakness, dizziness, tinnitus, insomnia, forgetfulness, numbness of limbs, abdominal pain and distension, pale tongue without coating, slow and stringy pulse. Dialectical, phlegm toxin flourishes, liver stagnation and blood stases, dampness and heat pour down, deficiency of both qi and yin. Treatment, invigorate the spleen and stomach, dry dampness, soothe the liver, resolve stagnation and dissipate stagnation, nourish qi, nourish blood and invigorate the kidney. Guard the pathogenesis and pay close attention. Start to take this medicinal decoction on October 6, 2022. After nearly a month of treatment and clinical observation, the patient feels good about himself. On November 4, 2022, he reported in a hospital laboratory in Jiaoqing City, clinical diagnosis, cancer the embryonic antigen, CHA. Result was 5 hours 65 minutes, and the hospital was 0 to 5 o'clock. After nearly 30 days of clinical treatment, the patient and APO's mental state began to recover and the above symptoms were affected. Specimen status, qualified, reference value, 0.005.00. Note, carcinoembryonic antigen is a kind of acidic glycoprotein with human embryonic antigen persistence, and it can also exist on the surface of cancer cells as a cell membrane structural protein. Discuss the surrounding body fluids, which are common tumor markers. This patient has a patient suffering tumor marker. When the cancer recurs and metastasizes, it can be significantly increased again. If the upper limit of the normal value is above 510 ml, it is necessary to be highly vigilant whether the cancer cells are in the active stage.
中医理
Although
论
the
不
precision
只有望闻
treatment of
问切，
modern medicine in
那
this
一贴贴
issue
药
of the
方
case,
更
the
蕴含着
data
中医药
obtained
学
from the
天人合
treatment
一、
test from
大医
June to
精诚的
September
思想。
2022 exceeded the reference value.
千百
It
年
can be
来，
seen that there are
中医药学
uncertainties in the
吐故纳
treatment,
新，
and it is still
吸
under
收融合各
exploration.
民族先进的技术，
Traditional
不
Chinese
断完善着
medicine
自
is
身。
based on qi
在新
transformation
的时
and
代，
treats
中医
based
药
on
学
syndrome
也与西医
differentiation,
有机融
examine the
合，
cause of the
在更
disease,
多的领
and
域
treat the
焕发
symptoms.
出勃勃生机。
After 1 month of traditional Chinese medicine treatment, the carcinoembryonic antigen result of 5 hours 65 minutes is close to the normal value for reference from midnight to 5 o'clock. This is the foundation of traditional Chinese medicine in treating diseases. Zhang Dongmai, female, 69 years old, was from Luqing City, Shaanxi Province. Cholangiocarcinoma. The patient went to a doctor on June 26, 2004. The patient was admitted to Heji Hospital affiliated to Shaanxi Chengji Medical College in May 2004 due to persistent vomiting and pale complexion. Later found out, obstructive jaundice hilar cholangiocarcinoma. Because the family was poor and belonged to the second batch of poverty alleviation targets, the leaders of the hospital arranged for an expert group to perform cholangiocarcinoma resection in the local geriatric health center. During the operation, it was found that the peritoneum of the external bile duct was invaded by the tumor, and the blood vessels were surrounded by the tumor, making it impossible to operate. Finally, they are stitched again. In the end, the doctor told me that the risk of surgery was too high and surgery was not recommended. In the end, the family had to give up. When the family members of the patient had nowhere to seek medical treatment, and the whole family was immersed in grief, the neighbor told them that Chen Hailin, an old Chinese medicine practitioner with excellent medical skills, could let him see a doctor. Because the patient was weak and bedridden, on June 25, 2004, the patient and Apo's family invited Professor Chen Hailin to the patient and Apo's home for consultation. First visit: emaciated body, sallow complexion, plus the patient and Apo's self-reported symptoms: Chen Hailin pulse, sight, smell and questioning. Chen Hailin and Apo's dialectic method is liver and gallbladder damp heat, qi stagnation, and blood stasis, and then prescribe the right medicine. From June 26, 2004 to September 26, 2004, under the spiritual support and careful care of family members for 3 months, the pain of the patient basically disappeared. After intensive treatment, the patient was allowed to go out for exercise, and he was admitted until mid-November 2004. After tidying up housework and taking more than 80 doses of traditional Chinese medicine for more than 5 months, the above symptoms were basically eliminated, and the old man returned to normal life. No recurrence and no metastasis for many years, returned to normal life, happy family. Patient Wen Yuzhao, male, 53 years old, from Hebei. Multiple myeloma. The patient went to Professor Chen Hailin for treatment on August 16, 2022. Chief complaint: low back pain for more than 2 years, low back pain for half a year, paroxysmal head pain for more than 10 days. The cytomorphological examination report showed that the current bone marrow imaging showed a significant increase in plasma cells. On the same day, another MR examination was performed, and the report showed multiple abnormal signals in the thoracolumbo-sacral vertebrae and their accessories. Combined with the medical history, it is consistent with the manifestations of multiple myeloma. 2. Flattening of the 12th thoracic and 2nd lumbar vertebrae. 3. Degeneration of the lumbosacral intervertebral disc. 4. Protrusion of the 4th lumbar vertebrae. 5. Protrusion of the lumbar 4 to 5 intervertebral disc with protrusion. Imaging findings: multiple round low-density areas of different sizes in the skull. Imaging observation: multiple round low-density areas in the skull, consistent with multiple myeloma changes. CT diagnosis report on July 22, 2022, plain chest CT scan, imaging opinion: abnormal density of thoracic spine, ribs on both sides, and scapula on both sides, combined with medical history, consistent with multiple myeloma manifestations. 2. BN changes in some thoracic vertebrae. 3. Scattered lung strips. 4. Abdominal lesions. Followed by bone marrow pathology report on July 27, 2022, diagnosis: extraplasmic myeloma. Combined with clinical and other examinations, as well as blood and biochemical index examinations, relevant examination materials are completed, and the patient will be discharged on August 6, 2022. 1 week after returning home, on August 16, 2022, under the leadership of an insider, I went to Professor Chen Hailin for treatment due to headache and dizziness. First visit: medium body, hunchback, inconvenient walking, vomiting, headache, eye swelling, red tongue with sticky coating, slow and stringy pulse, history of hypertension. Syndrome differentiation: brain and kidney insufficiency, liver and kidney blood deficiency, body fluid consumption, overstrain. Treatment method: invigorate the spleen and stomach, invigorate the kidney and liver, invigorate the brain, dispel stagnation, and remove blood stasis. Syndrome differentiation: brain and kidney insufficiency, liver and kidney blood deficiency, hidden body fluid consumption, overwork. Treatment method: invigorate the spleen and stomach, invigorate the kidney and liver, invigorate the brain and improve intelligence, dissipate stagnation, and remove blood stasis. Adhere to the pathogenesis changing with the disease, flexible medication mechanism, and adjust at any time. After more than 30 days of clinical treatment, the patient and APO's condition has improved. The second diagnosis and treatment on September 16, 2022, walking is better than before, low back pain is easier than before, nausea and vomiting are relieved, headache is obviously better than before, eye astringency disappears, energy is better than before, tongue is light red with less white and yellow. After addition and subtraction, continue to apply according to the original recipe. With my own efforts and according to the doctor and APO's advice, after a new round of clinical treatment and 2 full months of traditional Chinese medicine treatment, the patient underwent a CT examination at a hospital in Hebei province on October 20, 2022. Inspection conclusions: 1. There was no obvious abnormality in plain CT scan of the head. 2. Double pneumonia changes. After the brain tumor disappeared through CT examination, the patient and APOS myeloma also improved significantly. I can turn over and turn back and forth when I sleep at night, and I can sit on the bed in the morning. I used to be able to sit completely, but my back hurts when I sit, my head hurts, the pain is unbearable, my bending is better than before, and my height has increased to 156 centimeters, riding a bicycle into urban and rural areas casually. Since the end of the examination on October 20th, the patient has described that all physical indicators have returned to normal and has returned to normal life. Wu Ruiling, female, 59 years old, Chinese nationality from Guangdong Province. Come to see a doctor before October 4, 2022. Main complaint: I had left breast cancer resection in another hospital on May 6, 2018. In May 2022, colon cancer, ascending colon cancer, was detected during the physical examination, and he underwent radiotherapy for 5 months in the cancer hospital affiliated to Sun Yat-sen University, Guangdong. The overall decline of patients, a series of chain reactions, radiotherapy first, second, more effective. However, from the third time to the next 5 times, there's been no change in CEA, but the body reacted very badly, could not sleep well, could not eat, was weak, numb in the feet, and had poor resistance. So I decided to make a special trip from Guangdong to Shanxi to seek medical treatment from Professor Chen Hailin. The reported carcinoembryonic antigen treatment in the hospital for nearly 4 months is summarized as follows. Sun Yat-sen University Cancer Hospital Examination Report. Diagnosis of breast cancer. June 6, 2022. Say carcinoembryonic antigen 25:2. June 16, 2022. Silla CEA 12 hours 60 minutes. July 4, 2022. Say a CEA 908. July 19, 2022. CEA 8:7. August 1, 2022. Say a CEA 9:8. August 15, 2022 day CEA 8 hours 71 minutes. August 29, 2022 say 9 hours 81 minutes. September 13, 2022 say at 10:50. At present, the patient and APO's greatest wish is to quickly reduce the carcinoembryonic antigen to normal value by taking traditional Chinese medicine for 1 month. We are watching. First visit, emaciation, pale complexion, weakness, dizziness, tinnitus, insomnia, forgetfulness, numbness of limbs, abdominal pain and distension, pale tongue without coating, slow and stringy pulse. Dialectical, phlegm toxin flourishes, liver stagnation and blood stases, dampness and heat pour down, deficiency of both qi and yin. Treatment: invigorate the spleen and stomach, dry dampness, soothe the liver, resolve stagnation and dissipate stagnation, nourish qi, nourish blood and invigorate the kidney. Guard the pathogenesis and pay close attention. Start to take this medicinal decoction on October 6, 2022. After nearly a month of treatment and clinical observation, the patient feels good about himself. On November 4, 2022, he reported in a hospital laboratory in Jiaoqing City, clinical diagnosis, cancer. The embryonic antigen, CHA, result was 5 hours 65 minutes. The interval was 0 to 5 o'clock. After nearly 30 days of clinical treatment, the patient's mental state began to recover and the above symptoms were affected with treatment. In order to consolidate the efficacy of the agent, preparation on its basis and continue to take it for another month. On December 13, 2022, when testing the Cancer Hospital specimen serum, carcinoembryonic antigen, and the result, 537, specimen status, qualified, reference value, 0.005.00. Note, carcinoembryonic antigen is a kind of acidic glycoprotein with human embryonic antigen persistence, and it can also exist on the surface of cancer cells as a cell membrane structural protein. Discuss the surrounding body fluids, which are common tumor markers. But this patient is a patient suffering from tumor-associated breast tumor marker. When the cancer recurs and metastasizes, it can be significantly increased again. If the upper limit of the normal value is above 510 ml, it is necessary to be highly vigilant whether the cancer cells are in the active stage. Although the precision treatment of modern medicine in this issue of the case, the data obtained from the treatment test from June to September 2022 exceeded the reference value, it can be seen that there are uncertainties in the treatment, and it is still under exploration. Traditional Chinese medicine is based on qi transformation and treats based on syndrome differentiation, examine the cause of the disease, and treat the symptoms. After 1 month of traditional Chinese medicine treatment, the carcinoembryonic antigen result of 5 hours 65 minutes is close to the normal value for reference from midnight to 5 o'clock. This is the foundation of traditional Chinese medicine in treating diseases. Bladder cancer, minimally invasive resection. Wang Maoming, male, 73 years old, Chinese nationality from Yunnan Province. The patient and APO's chief complaint: the patient had a helical CT scan consultation report at the Yunnan Cancer Hospital on August 17, 2022. Diagnostic opinion: 1. The left upper wall and right lower wall of the bladder are regularly thickened, possibly malignant. Please combine with Mr. 1. 2. The subpleural nodules in both lungs are mostly considered benign. Please have an annual re-examination. 3. Low-density nodules in the right lobe of the thyroid gland. Please combine with ultrasound. 4. Abdominal aorta, arteries, atherosclerotic manifestations, slightly narrowed lumen. Calcified coronary plaques. Calcification of the aorta is possible. Please combine with ultrasound. 5. Right kidney micronodules, benign prostatic hyperplasia. 6. Arachnoid cyst on the right temporal pole is possible. 7. There was no definite abnormality in plain scan and enhancement of liver, gallbladder, pancreas, spleen, left kidney, bladder, and ureter. MRL consultation report at Yunnan Cancer Hospital on August 21. Imaging findings: bladder filling is good, left upper wall, left bladder triangle area, and right lower wall are irregularly thickened. The thickest part is about 18 mm, showing irregular nodules protruding toward the bladder cavity. Plain scan showed equal T1 and slightly longer T2 signal. DWT showed high signal. Connected with the broad base of the bladder wall, enhanced significantly after enhancement, the left upper wall. Adventitia was rough, and the surrounding blood vessels were tortuous and thickened. Bilateral, ureteral basin. The segment was not affected. The volume of the prostate increases. The size is about 53 mm x 30 mm, and it is unevenly enhanced after enhancement. No definite abnormalities were found in the bilateral seminal vesicles. No definite enlarged lymph nodes were found in the retroperitoneum and pelvic cavity. Diagnosis: 1. The left upper wall of the bladder, the left bladder trigone and the right lower wall are irregularly thickened. Bladder cancer may be considered, and the lesion on the left upper wall may involve the muscle layer. VT, RADS 4. 2. Prostatic hyperplasia. 3. In the retroperitoneum. Definite enlarged lymph node in the box cavity. Immediately afterwards, August 22, 2022, routine pathological examination report at Yunnan Cancer Hospital, pathological diagnosis, special stain, and quote, bladder tumor, and quote, winking smiling non-invasive papillary urothelial carcinoma, low grade, some high grade. If the tissue is broken, please make a comprehensive analysis in combination with clinical and other relevant examinations. The hospital requires the patient to return to the hospital as soon as possible for immediate chemotherapy and bladder cavity perfusion for 2 years after bladder cancer surgery. The doctor told the patient that auxiliary intracavitary perfusion after bladder cancer surgery is a promising method to prevent tumor recurrence. The doctor also told the patient the operation can only be performed within half a month, which only accounts for 25% of life, and the probability of recurrence after 1 month is much higher. However, the patient still insisted on abandoning Western medicine treatment after the operation and directly adopting traditional Chinese medicine treatment. On September 4, 2022, I went to Professor Chen Hailin for medical treatment. First visit: the patient was thin, with yellowish complexion, urgent urination, frequent urination, pain in urination still existed, insomnia, fatigue, indigestion, slight bleeding and candle burning sensation after operation, swelling in the temple, red tongue with yellow greasy coating, deep pulse, thin and stringy. Dialectical damp heat bets, accumulation of toxins, liver stagnation, and blood stases, resulting in symptoms. Therapeutics: clearing away heat and dampness, soothing the liver and invigorating the spleen, regulating qi and blood, dispelling stagnation. Observe carefully, stick to the pathogenesis, and treat symptoms. From September 5, 2022, he started taking traditional Chinese medicine for only 1 month until October 1. The patient and APO's feedback: only 1 month of taking the urgency, pain in urination basically eliminated, but the bloodshot urine and urinal burning sensations still exist, and other related symptoms are changing, and continue to take after adjusting on the original basis. Looking back on the Professor Chen Hailin has experienced too much in the difficult years. One sentence summary: 99 points of sweat, 1 point of inspiration, more than 40 years to achieve leapfrogging. Professor Chen Hailin expanded the space for thinking and imagination from multiple levels, systems, directions, dimensions, and channels. Combine traditional culture and of changes and quote, 5 elements and quote, with Qigong, yin and yang, and self-cultivation. Under the guidance of the theory of multidimensional addition of triple burner gasification in traditional Chinese medicine, it is organically combined with modern medical diagnostic methods and imaging data. Prepare symptomatic drugs, perform gasification, intervene in the gasification center, spleen and stomach in the human body, perform upper and lower gasification mechanism, enter the lesion, quickly curb the proliferation and metastasis of cancer cells, directly kill mutant cancer cells and repair missing mutant cells and cytoplasm, reversing cancer cells into normal physiological cells. Theoretical basis and quote, Hailin and quote, says, and quote, heaven is gas, earth is shape, and shape and gas are interconnected and transformed into all things. And quote, therefore, the understanding of human physiology and pathophysiology in and quote, internal classics and quote, is completely from the perspective of and quote, transformation of gas and quote, come to understand, from the perspective of and quote, gasification and quote, to study physiological phenomena, pathological phenomena, disease diagnosis, treatment. The preventive principle of the human body, through the evolution of gasification, can quickly achieve the goal of eradicating tumors. Using all specimens, a comprehensive cancer treatment plan with unique characteristics and innovative thinking of traditional Chinese medicine has been created.